We know that this is a really challenging time for people working in the NHS. Of course, we need to drive up the quality of care, and that's 24 hours a day, 7 days a week. But we're doing it at what's perhaps the most challenging time financially that the NHS has had in its history. So it's absolutely vital at this time that we invest in the skills of staff to improve the work that they do every single day, so that we can deliver better health and better quality of care, but do that at lower cost going forward. So AQuA works to make sure that frontline staff in every one of our AQuA member organisations and in our customers has got those quality improvement skills. We also work with leadership teams to help them create a really compelling, exciting vision of the future. And of course, we work to get NHS organisations working together, learning from each other, so that we can celebrate the best of what's being delivered and get that to spread more and more quickly across the service. We've listened really carefully to the kind of support that our members and customers are saying that they need from AQuA. And having done that, we think the 5 big priorities that we've been working on over the last year remain absolutely the right priorities for everybody. First of all, safety, making sure that patients don't come to harm in our care. Secondly, to make sure that care is delivered reliably on a consistent basis, 24 hours a day, 7 days a week. Thirdly, to make sure that patients and their families have a good experience of care that is caring and compassionate and where they're deeply involved in every decision made about them. Fourthly, to help join things up so that hospitals and community services and mental health organisations and GPs are working together, and so that we're transforming the way the system works to get that better health and better care at lower cost. And finally, of course, people need new skills and critically protected time to do all of this, whether you're a staff nurse on a busy medical ward or a member of a community health team, or you're sitting as a director on a board. You need the skills to be able to improve quality and make things better for patients. As we move forward into 2016-17, we know that the pressures on the NHS are immense. And we can't any longer solve the problems that we face just by working in individual organisations. We critically need organisations to work together. As somebody who's had elderly relatives through the healthcare system, I know that often you need your GP and a community nurse and sometimes a social worker, as well as the hospital, as well as maybe the mental health team as well, not to mention nursing homes and all of the other support that's provided for older people in the community. All of that needs to be joined up so that patients flow smoothly through the healthcare and social care system when they need us, without blockages, without waste and delays. And in the coming year, we aim as AQuA to work together with our members and customers to develop new approaches to that, to join the whole system up, to improve that flow of patients, and critically, if we can, to keep people healthy and keep them living independently at home, so that if they don't need to flow into the health and social care system at all, they don't. It's a new area of work for us, and one that we think can make a real difference, both to improving the quality of care that people get and getting the best use out of the scarce resources that we have. The NHS is facing big challenges, both in terms of the need to improve quality and improve health, but to do so at lower cost. And of course, we have a really exciting vision about how to do that, the NHS 5-year forward view. And right across AQuA's membership and many of our customers are working hard to think differently, to develop new ways of working, new models of care that bring services together in a different way. And AQuA is increasingly supporting people working not just as individual institutions, but working as whole systems, bringing together health and social care in a very different way. It's really exciting work, and we are learning as we do that, and we hope we're providing the right kind of support to our members and customers on that big transformational leap that we need to make. So we've been looking at the evidence base as to what makes the truly great healthcare organisations, the Mayo Clinics, the Kaiser Permanentes, what makes them really great? And there are a number of common features. First of all, boards and senior leaders are deeply committed to improving quality. It's a golden thread that runs right through the organisation. Secondly, they have a really clear vision and plan as to how they're going to achieve that. They have ambitious, bold goals and measurable aims that they get everybody behind. It's not simply what the regulator or inspector requires of them. They have a burning wish to improve and to be the best. Thirdly, they train everybody. They give frontline staff the skills and critically the time to improve the work that they do, to drive up quality, to deliver care at lower cost right across the organisation. Fourthly, they have a leadership style that engages and empowers frontline staff, doesn't tell people what to do, but supports them to get the best care that they can for patients. And finally, they join all that up, working with other partners, working with staff, yes, but also with patients and families and communities, so that it's really a whole team approach to making care better. These are 5 touchstones to which we think every AQuA member should aspire, and we really want to support people in working towards those. We'd like to see everybody within the AQuA membership regarded as one of the leading healthcare organisations anywhere in the world. AQuA's a bit different in the NHS. In fact, we're probably very different because we were created bottom up, not top down. Nobody up there somewhere told us to create AQuA. We came out of the will and energy of AQuA's member organisations to want to work together and learn together to improve quality. So for that to work, it's really important that we hear very clearly the voice of our members and of our customers beyond the membership, so that they are sharing with us the challenges that they face, being clear about what they need from AQuA, the kind of support that's most going to help them, but also sharing what works, celebrating the best, so we can get that to spread to other people. So we really need to hear from you. We want to hear what are the challenges that you face that you think AQuA can help you with, what are the things that you're really proud of, so that we can get that to spread, we can get everybody learning the lessons from the best.